Hey, Dr. Ken, how's it going? I just wanted to shoot you this video to kind of explain our strategy and how it's going to work. So essentially what we do is we're using Facebook advertising to acquire new patients, right? And let's just say we're getting a new lead for $5, right? In your case, it's probably closer to $2 or $3 right now. $2 to $3 for a potential plan of care that's worth $1,000 to the clinic, right? But as you said, right now, you guys are getting Spanish speakers. So, it's best if we don't, get these Spanish speakers because the lifetime value is not $1,000. It's only $200, right? Unless we're, so there's, and there's a huge pool of people who can pay you $1,000. So, we need to find a way to exclude those people, right? Essentially, what we're doing is we're acquiring new patients for every $30 to $40 spent, right? So that means every time you spend $30 to $40 on ads, you're getting a new patient. Ideally, that's worth $1,500 or more, right? Obviously, the higher that you can make your lifetime value, the more profit you're going to make, right? So if you're just doing physical therapy services, the lifetime value may be $1,000. But if you add cash services, if you add wellness products, if you add supplements, if you add courses, if you add a higher ticket package, you can bring up the lifetime value of that patient as high as you want, right? But it has to be done in a sustainable way. So let's just say right now, for now, ideally, your lifetime value is $1,000, and we're spending $30 to $40 to make $1,000, right? That's the end goal of all of this. Okay, so if we're getting you patients that are the lifetime value is only $200, $300, we're still only paying what $10, $20 to acquire a $200 patient. However, that's not ideal. So we need to find a way to cut those patients out and get the patients with $1,000 lifetime values. And the way that we can do that is there's several things, right? Instead of offering free, we can take that word out in the ad and say, hey, see if you qualify for a consultation with our board certified, specialist who can help you avoid back pain, right? So this way, this will kind of get rid of the people who are looking for freebies and the lower quality people, right? So that's one thing we can do immediately. Number two is we can have you create a video for us talking about the offer, right? Because when people see a face, when they see people talking, they know it's legit. So that'll bring the quality of the increase a lot higher, right? So maybe you can send us a video of your facility, like a selfie, just do a quick selfie. Hey, this is Dr. KenWheeler with Clear Cut Ortho in Texas, and I just wanted to let you know that we're doing something amazing for the community because of the whole COVID-19 crisis. If you're stuck at home, if you're having pain and mobility, if you've been told to get surgery, if you're on pain medications, if you have arthritis and you've never been able to solve this issue, if you've never been able to get to the root cause of this problem, well, you may qualify for a complimentary 30-minute consultation with me, right? That will increase the quality of the leads. And your front desk, what they're going to do, right, is they're going to screen out people, right? So when they pick up the phone, they're going to say, hey, Mr. Smith, this is, Alicia with the front desk at Clear Cut Ortho. I'm just giving you a call back to see what's going on. You responded to our ad, and I just wanted to make sure you're a good fit for the complimentary discovery session. Can you tell me more about what's going on? And she's going to qualify that patient for you. She's going to make sure that the problem is urgent, and and that person is a potential for a long-term care. And she's also going to qualify them to make sure that they're financially prepared to make an investment in their health, right? So they're going to ask them, hey, Mr. Smith, just in case you have a high deductible, or we don't take in-network insurances. Are you okay with a affordable monthly payment plan to get the help you need to get to the root cause? Is that okay with you? If they say yes, then schedule them. If they say no, okay, then Mr. Smith, sounds like you're right now, you don't have the financial means to get treatment. Maybe I'll give you a call back a month from now and see how you're doing financially. Once you get a job after this whole corona thing I'll check up on you in a month from now. How about that? Right. So there's 3 things we can do. Number 1, take out free. Number 2, use a video. And number 3, have your front desk qualify the patients more. Right. And the whole goal of marketing is to acquire patients profitably, correct? That's the hardest part, However, if we're spending $50 to make $1,000, you're seeing a 20x return on your investment, right? Every $50 that you spend, you're making $1,000, right? And if you're making $1,000 and you're not increasing your expenses, then all of that is going to be profit to your clinic at the end of the day. Do you understand? If you have empty space right now in your clinic, if you're not at capacity, every new patient that you bring on from our campaign is going to be revenue minus your fixed expenses, is going to be all profit, right? So that's the end goal. Replay this video again if you don't understand. But what we're going to do is, yes, let's get rid of free. Let's have a video of you speaking about your treatments. Get that video and make sure you have your front desk. Make sure your front desk understands and knows who a qualified patient is, and you teach them how to screen those people out. All right. Make sure you explain to them who you're looking for and what the types of pain and illnesses that they have, and make sure they understand the types of patients you need. So let me know if this makes sense, and send me an email once you watch this video, and I'll have Andy remove free and get that new video up to increase the quality of your patients, right? And at the end of the day, the numbers need to make sense, right? You're running a business, you have to look at the numbers, right? How much are we spending to acquire that patient, and how much money is that patient bringing you, right? And that will come with time. The more data that we have, the more that we can look at what's going on. So I hope this video makes sense. Send me an email, and then we can make those changes for you.